everyone. It's 2:30 on September 3rd. Thanks for joining us. This is Janet Hill of the Rock Island County Health Department. We appreciate you coming on our call today. We have three speakers. Normally, we have our normal speakers of Nita Ludwig of the Rock Island County Health Department, Ed Rivers of the Scott County Health Department, and today we have Brooke Hendricks, who is with the Child Abuse Council. She will be talking about child abuse rates during the pandemic. So Nita, let's start off with Rock Island County's numbers, please.
Sure, good afternoon. We are saddened today to report 2 additional deaths from COVID-19 in Rock Island County. A man in his 60s who had been hospitalized and a woman in her 90s who had been in a long-term care facility. Our deaths now total 67 in Rock Island County. And our deepest sympathies go out to the friends and families of both these individuals. In addition to those, we have 32 additional new cases of COVID-19, and that brings our total cases to 2,322. Labor Day weekend usually means the last hurrah of summer. We fill the weekend with cookouts and family and friends, Labor Day parades celebrating American workers, and the Rock Island district full of the Grand Prix go-kart drivers and fans, but not this year. We all want to do all of those things, but we cannot let our guard down now. We know what will happen if we do. After Memorial Day, we saw a spike in cases on both sides of the river that really hadn't fallen. We saw even bigger surge after the 4th of July. No one is saying that you can't have fun this weekend, but it does have to change. Have your party, but just keep it small, outdoors if possible, and physically distanced, and have everyone wear a mask. Spend time walking or hiking in one of our region's beautiful parks. Go for a bike ride along the river. Get takeout food from your favorite restaurant, and wear your mask when you go in to pick it up. Find ways to have fun, but please do it with COVID-19 in mind. And I'll say it again, when you're away from home, wear your mask. Until we have a vaccine or an effective treatment, the virus calls the shots, holiday weekends and every day. Please do your part to take care of our community so that maybe next year we can do all of these things that make summer in the Quad Cities great. Thank you.
In Scott County today, the Iowa Department of Public Health reports 2,277 cases. Our deaths remain at 21. And as Nita discussed, we can't afford to let Labor Day become a trampoline that propels our COVID-19 cases upward again. Our healthcare systems are stressed when an increase in cases leads to hospitalizations and ICU admissions. Our public health systems suffer from contact tracing load for the 30+ daily cases and the subsequent close contact follow-up calls that these cases generate. Our schools don't need the added workload and the stress that's generated when additional cases are found in families and eventually school facilities. So how do we prevent this? We keep our Labor Day small and simple. We take a rain check for next year's Labor Day. 2020 isn't like any other year. And so the things we do in 2020 can't be like what we've always done. We keep using our prevention tools. We keep distance between ourselves and others. Wear your mask. Find a mask that's in your school colors. Whatever it takes, wear your mask. Stay home if you aren't feeling well. Make smart decisions that won't put parents, siblings, kids, sports teams, and social groups at risk of having a 14-day timeout from a quarantine, or worse yet, to get sick. We are one community, and it takes each of us to care for all of us.
Thank you, Ed and Nita. Next, we will hear from Brooke Hendricks, Director of Development and Communications with the Child Abuse Council. Please go ahead, Brooke.
Hi, thank you for having me here today. Again, I'm Brooke Hendricks. I'm the Director of Development and Communications at the Child Abuse Council in Moline. I was on a few months ago talking about how COVID-19 increases the risk for child abuse for kids in our community. As Nita and Ed have both stated, nothing has really changed. If anything, things have gotten worse as far as numbers go. So beyond isolation and additional stress, we also now have families who are losing family members, who have family members who are sick and hospitalized, and that's adding to their stress. So with the risk of child abuse increased due to, again, family isolation and stress and families losing some of their support people, you would expect an increase in child abuse reports, and we're still not quite seeing that. With the Child Abuse Council, we don't receive reports directly. DCFS and DHS receive those. But what we usually see is an uptick in referrals based on reports that are founded in the state or in our area. And we're not quite seeing that either. We've had a few new referrals from families just because of COVID. Families who noticed that their kids were under a lot of stress, their behaviors were different, had nothing to do with abuse or neglect. They just wanted to get some treatment and make sure their kids had someone to talk to and that their mental health was taken care of. But cases haven't been being reported quite the way we think that they normally would be. Like Ed referred to, this is 2020, nothing is normal. The state has actually seen nearly a 50% decrease in child abuse calls. That does not mean that child abuse has decreased 50%. It again speaks to the isolation of families, the isolation of children. Kids are just now returning to school, but prior to that, daycares were closed, schools were closed. Kids didn't have contact with teachers, coaches, childcare providers, all those people who would normally make reports of child abuse. So really we're calling on the community to continue to report if you see something. Most obvious signs of child abuse are physical. They're bruises and marks that can't be explained. But if you have a child in your life whose behaviors have changed drastically and you can't link that back to the weirdness of 2020, talk to someone, reach out. It doesn't necessarily have to mean you're reporting abuse or neglect, but taking care of your kid's mental health is important too. And figuring out the cause of those behavior changes, possible sleep changes are all really important to your child's health. The Child Abuse Council is open. All of our services are open. So if you have questions, if you're not sure whether to report something, or if your child just needs someone to talk to and to talk things out with, because 2020 is weird, please reach out, email, phone call, and we'll make sure that you're connected with the right people if it's not us. Again, thank you for having me today.
Thank you so much, Brooke, for joining us. That information is very important. We've been talking about what happens when cases fluctuate so much and we see increases, and we know that even at lower numbers, because of the decisions that causes, our kids are in different areas than they normally would be. So it's very important for us to keep that in mind as we try to figure out ways that we can get ourselves through this type of a pandemic, this type of an event. So we will open it up to any questions. We have Brooke who can answer some if it's related to her, as well as Ed and Nita. So please type any into the chat and we will get to those. It looks like for you, Brooke, is the Child Abuse Council doing fundraisers this month? That may be something that takes a hit with an event like this as well.
Yes, we are currently holding our we revamped it for 2020. It's a no-show lifesaver celebration gala. Basically, it's just on our social media and through email all month long. So if you're interested in anything there, please follow us on Facebook and Instagram. This is our replacement fundraiser for what normally takes place in person in April.
For Nita, this is a question. Friendship Manor has announced it's doing some weekly testing. Have you heard about that?
Yes, all the long-term care facilities are in touch with our infectious disease nurses, and they consult with them on a regular basis.
And it says, do you think it will help, and what's the purpose?
Part of that is guidance from the Illinois Department of Public Health. When our case counts are so high in our county, and especially because of the vulnerable populations in long-term care facilities, the Illinois Department of Public Health asked them to test their residents more often. So in this case, right now it's weekly.
Great. Brooke, any additional tips if someone has some thoughts about whether or not they should call? What's the process for doing a report if they're suspecting any sort of abuse of a child?
Really, you just need suspicion. You don't even have to know who caused the abuse or where the abuse is coming from. If you report your suspicion of abuse to DCFS or DHS, depending on which state you live in, DCFS is Illinois, DHS is Iowa. You just have to report and then let the investigators do their work. If it's a more severe case where the police need to be called for people's immediate safety, that would be the best route to go there. And again, let the professionals do their work. You never have to accuse someone in the calls that you make. You just have to state the suspicion of abuse.
Thank you. Nita, there is a couple of follow-up questions here. Are all the nursing homes doing weekly tests?
Yes, I do believe that is the requirement from IDPH because our case counts are higher, that they are required to test weekly.
Nita, it's correct that a lot of the data on those long-term care facilities is on the Illinois Department of Public Health's website.
Yes, it is on the Illinois Department of Public Health website on the COVID page, which is the home page. Just click there, and it has a link to long-term care facilities with outbreaks in Illinois.
And there's a follow-up question on Tyson and Jocelyn. Do you have an update on numbers of deaths and cases?
Sure. So they have done an excellent job at Tyson, and we've said that on a couple of different occasions. Their numbers have really leveled off for the last 2.5, almost 3 months now. So there haven't been any increase in cases there. And for Rock Island County, early on, they did have 2 deaths of workers that worked at the Tyson plant, and that remains the same number.
Looks like it's confirming 163.
I think it had leveled off at 166, but it has been that number for at least 2 months now.
Okay. Seeing no additional questions, we'll go ahead and conclude today's briefing. Thank you all for joining us. Thank you again. Oh, go ahead.
Sorry, it's Janet. We did get one question that was early. It's for Nita. Trying to get some clarification on what the positivity rate is in the county. That is reported by the State Department of Public Health. But Nita, can you speak to that a little bit?
Sure, that is a number that is calculated by the Illinois Department of Public Health, and they post those numbers every Friday. So right now what is showing is the prior 2 weeks ago, and tomorrow it will be updated to the week ending August 28th. On the current page, it says our positivity rate is 6.6% for Rock Island County. And again, we don't calculate that here locally because we only get the positive cases here in Rock Island County. We do not get results of every test that was done. So we could not calculate that figure ourselves, but the state does it, and they update it every Friday around noontime. It should be updated tomorrow.
Okay. Thank you again, everyone, for joining us. Just wanting to make sure I don't think we have any additional questions. Thank you, Brooke, for being here again. We appreciate it. Thanks for joining us. Thanks for sharing this important information. We really rely on our media partners to help share this. We'll continue to post the recordings on the Scott County Health Department's website, as well as their social media pages, so you can find that for additional information. Thanks for joining us. Have a great afternoon.